नमस्कार. अलर्ट, ॲक्टिव्ह अँड अलाइव्ह ॲट 100 ह्या कार्यावळीन तुमचे स्वागत. डेम्पो हेल्थकेअर प्रस्तुत ही कार्यावळ आम्ही स्वर्गीय श्री विश्वासराव डेम्पो यांच्या यादीन राबयतात आणि दर शुक्रारा रातचे 10 वरांचेर आम्ही तुमच्या मुखार येतात आरोग्य आणि स्वास्थ्य हे विषय घेऊन त्याबद्दलची चर्चा करपाक. आमच्या बरोबर आसात Dr. Digambar Naik, a renowned cardiologist from Goa and whose name has already been recognized as one of the 50 pathfinders of the Indian healthcare industries. Namaskar, Doctor. Welcome to the show.
Thank you.
Dr. Naik has written a book, namely Alert, Active and Alive at 100. आणि त्याच पुस्तकाच्या आधाराचेर आम्ही हांगा वेगवेगळे विषय हाताळतात त्याच्याबद्दल चर्चा करतात. In this book he has elaborately discussed and written about how to live a healthy life and maintain a healthy lifestyle, and not only that, he has stressed elaborately on how to maintain your mind and discuss so many things about the same. Well, आमचे डिस्कशन ह्या विषयाचेर बरेचशे जाल्ले आसा, पण त्या विशयाकडे वळच्या पयलीं आमी डिस्कस करतात ते आमच्याकडे पळोवप्यांनी विचारिल्ल्या प्रश्नांची उतरां दिवन. तर दर आठवड्यान दर दिसा डॉक्टर तुम्ही यू सेंड टिप्स टू एवरीबडी अबाउट हेल्थ अँड लायफस्टायल अँड हाऊ टू मेंटेन युअर हेल्थ अँड हाऊ टू अटेन the 100 years.
You need a reminder every day.
Well, I think in last 2-3 days just 2-3 days back, you have made a very strong statement on the use of aspirin and how it prevents stroke, heart attack, and you have mentioned about colon cancer. Now we have been using aspirin for various reasons and for years together, and it has become a household use, and now people want to know about this aspect of aspirin.
I think this is a very, very important प्रश्न सामको. कित्याक आमी aspirin वापरता, but if you misuse the aspirin, it can also kill you.
Right.
Okay,
right.
It is not.
And I think this we have been doing for a long time.
So this is what we should very well understand by aspirin. आता heart attack बी कित्याक वापरता आमी? You can get an heart attack suddenly or a stroke suddenly. Something happens there, and a small sort of atheroma gets ruptured. Platelets get released, and platelets are sticky, Once they come out of the vessel, out of the capillary, they stick whatever comes to them. So whatever are the RBCs, they keep on getting stuck to these platelets, and a clot suddenly forms. Okay. Aspirin works exactly on this clot. It works on the stickiness of the platelets. या plateletaचे stickiness कमी करता. So even by mistake it is ruptured out, few platelets have come out, थंय clot जावचो ना. So obviously आता इतली वर्सां aspirin वापरता, we almost call it a wonder drug.
Right.
कितलेशेच drug, so many heart attacks I'm sure have been prevented. एकदा heart attack येलो की we keep that patient on aspirin for the rest of his life. And I've seen after one heart attack, after 30, 40, 50 years also, patient hasn't got a second heart attack, even when he has not done bypass or so many other things. So that much is the effect of aspirin. So also same mechanism works on the stroke. Okay. Even aspirin is used, even in pregnancy we use aspirin. If you have a very complicated pregnancy, this pregnancy can lead to DIC, bleeding, bleeding burns after delivery. And we have lost mothers with that bleeding. So as खूप gynecologists will put their patients on a very small dose of aspirin, so that they will keep the health of the platelets. Okay. And what is this small dose? Okay, the small dose is supposed to be, we call it baby aspirin, supposed to be 75 or 80 or maximum 100 milligrams a day. Aspirin कितें करता? If you take more of aspirin, aspirin can give us ulcers in the stomach, and ulcer जर जालो हांगा, it can be so bad sometimes you are giving aspirin, you are not allowing the blood to clot, and you got a small ulcer, it keeps on bleeding. And चालूच उरता ते low आमचे तकलेन सुद्धा येना. So aspirin can give rise to bleeding if it is used without doctor's supervision. I would say all those people who are using aspirin should consult or should keep themselves under the hand or under the supervision of their doctor. Tell the doctor, I am taking aspirin. Doctor will find out whether you really need aspirin. Everybody should not take aspirin. Okay, that is the first thing. There are definite indications where we say, okay, now aspirin घेतनाला lots of side effect लक्षात दवरीत, your benefit would be much more than that little side
Now, what
effect.
are the cross indications, may I ask for?
Yeah, okay. Oh, perfect. Before that, we talked about cancer. No?
Right.
So
Colon
this is today is also one of the drugs used to prevent colon cancer.
Okay.
And there are lots of studies which are, the action is again on the platelets and on the other some smaller particles which stimulate first to get a cancer. Okay, so it is used even in cancer, and there are many more small indications. I wouldn't tell this here because they are to be used only by the very strict supervision of doctors. आता aspirin घेतणारे किती जाता, white side, the other part of aspirin. First of all, normal person also can get an ulcer. दुसरे there ulcer घेवपी ulcer तुका जर ulcer आसत, you should not take aspirin. दुसरे तुका bleeding tendency असता थोड्यांक. आमचे blood भायर सरले की it clots. With some people it does not clot, like hemophilic and many more other conditions. Okay, I wouldn't name them because they'll only confuse the whole thing. अशी खूपशी कंडिशनां आसात जेन्ना मनशाचे रगत clot जायना, and for them aspirin will be a contraindication. So aspirin never, unless you know exactly whether you need aspirin or you don't need an aspirin, you should not take aspirin. It's a wonder drug. It will help you get many more years of your life. But it is a drug. It is a drug finally, and any drug has to be used under a good doctor's supervision. That's what I would basically try to say.
So this is a good note that we should do, because aspirin is a household drug. And लोकांक अशें दिसता की just because it is termed as wonder drug, they can just pop a pill whenever necessary. And this is the most dangerous thing that we are doing to ourselves, our bodies. तर आमकां आतां कळ्ळां आसतलें की एस्पिरिनचे कॉन्ट्राइंडिकेशन सुद्दां कितें आसात ते. बट मे आय आस्क, लायक वॉट एक्झॅक्टली कॅन बी अ इंडिकेशन ऑफ एस्पिरिन? कित्या कारणान जर सपोज एस्पिरिन इज पॉप्टेड
नॉर्मल आमी खंयच्या पेशंटांक दिता, एकदा एक हार्ट अटॅक येयलो म्हणजे ताका आमी कीप ऑन एस्पिरिन. एक स्ट्रोक येत नाल्यार थ्रोम्बॉटीक स्ट्रोक दोन तरेचे, थ्रोम्बॉटीक आनी हेमरेजीक. एक तर ब्लिडींग जाता नाल्यार क्लॉट जाता. थ्रोम्बॉटीक स्ट्रोक आसत नाल्यार तो पेशंट आमी लायफ टायम एस्पिरिनचेर दवरतले आनी ताका पोटान अल्सर जावंक जायना म्हणून विल गिव हिम समथींग H2 ब्लॉकर्स म्हणटा ते मेडिसिन दिता. सो इट टेक्स इट व्हेरी सेफली. थर्ड थिंग, इट इज यूज very often in gynecology, in delivery today. Once you get pregnant, there are a lot of complications with pregnancy. There the gynecologists would prefer to use aspirin. Many of them, okay, and they use it safely. Once they are using it, they will use it very safely. I don't think any patient has to be very worried about taking aspirin if he's taking that under the supervision of his doctor. That's number one. Suppose you have angina. I have angina, I might get a clot. Okay.
Can you a bit explain what is angina? Because this is a medical term, so people would like to know.
अंजायना म्हणजे कितें? अंजायना इज अ चेस्ट पेन. कसली चेस्ट पेन? हार्टाची चेस्ट पेन. काळजाची शिरो, आमच्यो 3 मेन शिरो आसता न्ही, ती एक शीर जशी ब्लॉक जायत येयली, बारीक जाली काय ना, मातसो एक्सरसायज केलो, मातसो टेन्स जालो, मातशें काळीज फास्ट चल्लें, तें रगत त्या शिरेंसून वता, तें काळजाक पावना. सो इट इज लॅक ऑफ ब्लड which gives rise to pain in the chest. Okay, lack of blood means patient is almost about to get an heart attack. That is angina means patient is on his way to get an heart attack. So there where we use aspirin so that he does not get an heart attack, and we use it very well, beautifully it is used, and it is a wonder drug. Basically you use aspirin for a headache.
Right.
It's a painkiller. But painkiller म्हणून वापरताना आम्ही कितले वापरताना डोस? more than 300 milligrams at a time. And sadaat we take it on full stomach so that it does not irritate the stomach. For prevention of an heart attack or prevention of a stroke, or even prevention of cancer, we use a very small dose called baby dose. Either it is, in some countries it is 80 milligrams, In our countries, it is 75 and 100 milligrams. In some countries, I fixed it as 100 milligram. And there are types, It's just called soluble aspirin. It's called enteric coated aspirin. Aspirin bitar asa teje coating galta. That means it does not get absorbed into the stomach. It goes into the intestine and gets opened up. Okay, and then it gets absorbed. So it does not irritate your stomach. Dusre asa dispersible, like dispirin tablet. You put that tablet into water, it dissolves, and you can even drink it.
Right.
Okay, and it is less likely to irritate our stomach or give rise to problems into the stomach.
So I think we have learned much more about aspirin that we should have all this while.
Yeah, all of us have aspirin in our houses.
Right. And खंयचेय ड्रग आणि खंयचेय वखत ताच्याबद्दल चडान चड माहिती घेऊनच ताजो उपयोग करचो आणि द बेस्ट थिंग इज डॉक्टराच्या सल्ल्यानूच करचो हे आमकां आतां कळिल्लें आसा. तर फुडें वचच्या पयलीं आय थिंक वी शूड ब्रश अप वॉट वी हॅड डिस्कस्ड ऑल दीस वायल. वी वर टॉकिंग अबाउट रूल्स. आमी रूल्स बद्दल उलयताली आणि पहिलो रूल जो आम्ही घेतिल्लो तो शार्पन युअर माइंड. रायट. आणि ताज्या आम्ही बरेचशे शिकिल्ले आसा. आणि रूल नंबर 2 वॉज पॉझिटिव्ह एटिट्यूड. अँड आफ्टर दॅट वी हॅड डिस्कस्ड इलॅबोरेटली ऑन हेल्दी रिलेशनशिप. दिस वॉज अ व्हेरी ब्युटिफुल डिस्कशन कारण रिलेशनशिप इज समथिंग विच वी कॅन we can explore and talk about in.
And you cannot afford to spoil your relationship with anybody.
Right, and we take it for granted and amka कळून चुकिल्ले आसा की that is the most important thing that we should take care of.
And most of us falter here.
Right.
Most of us spoil our relation with somebody. We spoil our relationship with our own children.
Right.
We spoil our relationship with our own spouse. We spoil our relationship with our own family members. We spoil our relationship. It's a common thing for everybody to spoil their relationship with their neighbors. And on our job, on our boss. So we can't have a bad relationship with boss.
Anybody, even with ourselves. And I think when we say that, we have to talk about stress. And I think that is your rule number 4. That is the stress-free life. I think stress is something that sours the relationship with everyone all around. So I think this is the time now to discuss about the rule number 4 and which
how
says
to live a life without
stress-free life.
Okay, there is nothing called stress-free. This is the first thing. आमची तकलेचो इल्लोसो stress ना. Now you have come all the way here. Okay, without that little stress, you wouldn't have come. Today we are seeing. Actually, we are all watching cricket. In IPL, we see what the stress is.
Right.
When the man is stressed, what mistake that he does. And when the man is really enjoying, how beautifully he does it. He does it the best at that time.
Right.
What is this? Everybody has a stress.
Right.
One man does best, one man does worst. Okay.
So I think everybody reacts differently to stress.
Yes. We need to have that reaction. We need to have that stress on us. Otherwise, there's nothing. There's no stress on my mind.
Right. You have mentioned it in your book that there is something called as positive stress.
Yes.
And which
it's
works on
eustress.
Right.
It's a normal stress we all need to perform. And if we take that stress as a positive stress, we will perform better. Even for basic performance, we need that stress. And that stress, we call it as a eustress. Eu means normal. And the opposite of it is distress. Distress means which is hurting you. In distress, the stress is affecting you in a negative way. Is affecting you